Hey, Dr. Tyler Williams at Sleep SLC. Thanks for taking a minute to check out this video where we're talking about snoring remedies and some of the snoring causes. Now, for specifics on the difference between snoring and sleep apnea, you can check out some of our other videos that go more in depth on that. But you're here because you'd like to know how to help somebody with snoring, or maybe you're snoring. And the first part, which is great, is that you recognize that snoring is an issue for you or your bed partner, because many people snore and they don't even know it, or they think that they're just sleeping in a funny position. And really, snoring can be very unhealthy. The sound alone isn't the problem, other than it can disrupt your bed partner. But for most people who snore, they don't even know they snore and it doesn't disrupt their sleeping. But if you're snoring and you occasionally wake up coughing or choking or feeling like you're out of air, or you just suddenly wake up and you're not sure why, could be because you actually stop breathing for a split second. And that's where a home sleep test would be your next step, which is a device you wear on your wrist and your chest, depending on what your condition is, or if you're using medical insurance, there's different devices that are approved. But this is a device you wear in your home. Think about it like a really fancy Apple Watch that's going to measure a whole bunch of things when you sleep: breathing, your position, your oxygen levels. And from that, you're able to get a diagnosis as to the specifics of your snoring and if there's other things involved. Some of the common ones we see, especially if you're female, if you have thyroid issues or a history of thyroid issues, if you've had a history of heartburn, acid reflux, or high blood pressure, and then you have a small airway or a small mouth, and maybe you just don't sleep well, there's a high chance that you may have what we call silent snoring, which means that it doesn't always make a loud sound, but you're not getting enough oxygen, and that can be a side effect of sleep apnea. For males, if you have a 16-inch or larger neck size, history of high blood pressure, if you have a history of being overweight, then your chance for sleep apnea is very high. If you have all those things and you're over 65, there's about a 95% likelihood that you currently have sleep apnea, and it's more than just snoring. So the way I got into this is we do a lot of sedation in our dental clinic, and we started seeing people often snore or kind of cough or choke when they were sedated with an oral sedative. And an oral sedative makes you very, very relaxed, but it does not put you to sleep. And what that means is you can kind of naturally fall asleep during the day, so you can have a procedure done and you don't have to think about it or hear about it or remember it. And so I started observing so many people would snore or gasp or stop breathing for a split second. And we use different devices to measure people's oxygen rate when they're sedated. But when we started seeing that, we realized this was a much bigger problem than even we anticipated. I myself personally snore, and so I wear a device that helps my wife sleep better, because when I occasionally snore, it can disrupt her a little bit, and I get an elbow in the ribs. When I wear this oral device, it's not a CPAP, it was not surgically placed, but it's an oral device that helps her sleep better and helps me sleep better, because I also noticed I started feeling more refreshed because I'm getting more oxygen and breathing better. So if you feel like this is something that may help you, or you have some more questions on snoring remedies, give us a call or text us. We have a book that goes into more detail about this and things you can do, such as position and things you can do to help prevent you from rolling on your back, and diet, things that you should look out for, not eating after a certain time, avoiding caffeine after a certain time, and those types of things. So I hope these tips have helped today, and we look forward to seeing you on the next video. Have a great day. Thanks.